Hello and welcome. Every parent has had that moment. You see a new, unfamiliar rash on your child's skin and your mind just starts racing. Today, we're going to move past the common stuff and really focus on the pediatric rashes you absolutely need to have on your radar. Let's dive in. We all know the usual suspects, right? A little heat rash, maybe a minor bug bite. But some rashes, well, they're signals for something much more serious. So, which ones really demand your immediate attention? We're about to find out. To make this super clear and actionable, we've broken it down into 4 key categories. We'll talk about severe infections, rashes that signal deeper genetic issues, a hidden outdoor danger, and a pretty surprising after effect of a common illness. Okay, first up, and this is the most critical category, severe infections. These are the rashes that are true medical emergencies, where every single moment counts. Okay, let's look closely at these images because they really show just how dramatic and severe this can get. On the left, you can see all that peeling and redness right around the mouth. And on the right, wow, large sheets of skin are actually coming off the child's back. This is something called staphylococcal scalded skin syndrome. The name really says it all. It's an infection caused by a toxin that makes the top layer of skin blister and peel away, almost like the child has been burned with hot water. This is a very serious condition that needs urgent hospital treatment for sure. And here's our next example, Kaposi's varicelliform eruption. See how distinct that looks? Those small, uniform blisters almost look like they've been punched out of the skin. This is a severe viral infection that can spread incredibly fast, especially in kids who already have a skin condition like eczema that's weakened the skin's defenses. So, the takeaway for this whole section is simple, but it is absolutely vital. If you see a rash that is spreading fast, blistering up, or causing the skin to peel like this, do not wait. That is a signal to get immediate medical care. All right, next up, we're going to look at rashes that are kind of like messengers. They're external clues that can point to an internal and often genetic condition that really needs to be investigated further. Now, at first glance, these scattered brownish spots, well, they might just look like birthmarks. But this is actually a condition called mastocytosis, and it's caused by way too many mast cells in the skin. It can be a really important outward sign of an underlying systemic issue. Now, this is a fascinating clue. What you're looking at is known as a cold abscess. Unlike a typical abscess from a bacterial infection that's hot to the touch, this one isn't warm. This specific sign is a hallmark of something called hyper-IgE syndrome, which is a genetic condition that affects the immune system. So the key thing to remember here is that some rashes aren't just a skin problem. Nope. They are the body's way of telling you that something else is going on under the surface, which makes getting a proper diagnosis absolutely essential. Okay, so from internal clues, we're now shifting our focus to an external threat. We're heading outdoors to talk about a hidden danger that's way too common and really easy to miss: the threat of tick bites. Take a close look at this slide. Tucked away in the hair, there it is, a tick attached to the scalp. This is a perfect example of a hidden danger. Ticks can carry some nasty diseases, and because they're so hard to spot in places like the scalp or behind the ears or in the armpits, doing a really thorough check after playing outside is just vital. So what do you do if you find one? I know, your first instinct is probably to grab it and pull it out, but that is exactly what you should not do. Here's why. Trying to yank it out yourself can break off the mouth parts, leaving them stuck in the skin. Even worse, if you squeeze the tick's body, you can actually force its body fluids and any nasty germs it's carrying back into your child's bloodstream. That just skyrockets the risk of infection. The safest, best option is always to have it removed by a medical professional. Of course, prevention is always the best strategy, right? Simple things like having your child wear a hat, long sleeves, and long pants when they're playing in grassy or wooded areas can make a huge, huge difference in preventing tick bites in the first place. And for our final category, we're looking at something that can be pretty alarming for parents, but is actually not dangerous at all. It's a surprising and totally unexpected after effect of a very common childhood illness. It all starts right here with hand, foot, and mouth disease. A lot of parents are familiar with these telltale blisters on the hands, feet, and inside the mouth. It's a super common viral illness that usually just runs its course without any big problems. But then, weeks or even a month after the illness is totally gone, this can happen. A fingernail or a toenail just starts to lift up and shed. It can be really startling to see a nail just fall off, seemingly out of nowhere. But here's the good news. This is a known side effect of the virus. So while it looks really dramatic, the nail shedding is temporary and it's completely harmless. A brand new, healthy nail will grow right back in its place. So after covering these four very different categories, let's pull it all together into a simple toolkit of key takeaways for you. Let's recap your parent toolkit. Number one, and this is maybe the most important, trust your instincts. If a rash worries you, get it checked out. Two, remember those severe, rapidly changing rashes are emergencies, so act fast. Three, prevention is your best defense against outdoor risks like ticks. And finally, number four, keep in mind that not all dramatic symptoms, like that nail shedding, are actually dangerous. So, armed with this knowledge, how can you best advocate for your child's health? The goal here was never to cause panic. It's to empower you with knowledge, because knowing when to act, and just as importantly, when you can be reassured, is one of the most powerful tools any parent can have. Thanks for watching.